I'm Siraj, one of the PGY3 ER residents. Just going to go over a central line today. We have a kit over here. The most important part is making sure you're set up correctly. Make sure you have your flushes. Ordinarily, you would have 3 caps to put onto the central line, a bio patch, and a Tegaderm, and we'll go through each of those things in a moment. So first things first, if you have one of those kits where the flushes are in the separate sterile pouch, then you'll be able to do this part on your own. Otherwise, you might have to have an assistant get the flush here and put it somewhere in your central line tray. So I usually like to put mine right here in this little container. And just go through the different parts of the kit. We have our main injection needle, which can be interchangeable with this. And then when you prepare, you want to make sure that this plunger works pretty easily and that the needle detaches easily from the plunger. You have your guide wire. When you check your guide wire, you want to make sure the guide wire threads easily. I usually like to maintain my guide wire in this position. You have your blade and then your dilator, which you're going to use once you have the guide wire threaded through the needle. And lastly, we have our actual catheter, which you're going to thread over the guide wire once it's dilated. And the default for the catheters come with these 3 blue caps. So these 3 blue caps get interchanged. So you take them off, and then this is where you'd have the normal Lurlock caps that you put. So you'll have 3 total. You start by putting a cap on the blue port and the white port, and you leave the brown one empty because your guide wire is going to be coming out from the brown port. So the important thing to do before starting is to make sure that the line flushes properly, that the catheter flushes properly. So I'm going to take this empty syringe here. I'm going to fill it. And then I'm going to make sure that each of these ports works. And then I always leave the tip over here so that way we can conserve saline. And lastly, over the brown port. So it looks like this one flushes really well. We have that here and ready. All right.
Just go ahead.
So now we're going to start with our procedure here. So we have ultrasound here. So I have my non-dominant hand using the ultrasound. And I take my hypothenar eminence and rest it on the patient's skin to help steady the ultrasound probe. You see right here, you have a nice visible vein, and then it compresses. That's one way to check, make sure that it's a vein. I'm try and have it centered on my screen, so that way I know exactly where to inject here. So I take my needle, and about 1 centimeter away from the probe, I'll penetrate the skin. And I keep my probe at about a 90-degree angle to my needle to help with visualization of the needle tip. So I'm going to go ahead and inject here. And then you just...
See ya. There you go.
So I bring my probe all the way to where the needle is entering the skin, and I follow it down like that.
Perfect. You can see it go right in the vessel.
And I slowly advance. It goes right there. Just aspirate beautifully at that point. So now I'm going to gently lay down the probe and steady the needle with this hand, and then unscrew the plunger. I'm going to take my guide wire and then thread it through. at least 30 centimeters. At this point, I'm going to take my needle out, and before dilating, I'm going to make sure that I'm in the right place. Now you do a long view, see right there, the guide wire is resting nicely in the vein, so you can confirm that you're in the vein instead of the artery. Now at this point, we have to dilate. So take this blade, and there's a razor edge that I face away from the guide wire. I just make a small incision here in the skin. I'm going to take our dilator, I'm going to thread it through over this guide wire. The important part is not to jab like that, but to twist it in. Otherwise, the guide wire can get kinked. And once it's in a few centimeters, you pull it out. Make sure to keep a hand on the guide wire. And normally at this point, you might get a little more blood coming out, so it's important to have some extra 4x4s on hand. And now for this final step, we have our catheter here. So we're going to put it over the guide wire. And then we're going to slowly feed it over. But the important thing is to stop right before this catheter enters the skin, and then feed the guide wire backwards until it comes out of the brown port. And once it does, and you can secure your hand on the guide wire on this end, you can go ahead and feed this catheter in. And you can pull the entire guide wire out. And at this stage, you put the final cap on to the brown port, and then you should be set. And then now we just have to make sure that all these ports draw well and that they still flush. So I fill this about halfway with saline. I'll go over here, I'll withdraw a little bit, and ordinarily you'd see blood coming back, and then I'll flush it just to make sure that it still flushes. I'll do the same thing for all 3 ports. And I try not to leave any blood within the lines because then they can clot and that can cause problems down the road. So once this is done, we have our bile patch here. So right where the catheter enters the skin, we place this patch here. In this particular model, suturing might not be possible, but these. So in the case of, if you're doing a femoral if you're doing a femoral central line, you do the 2 sutures here. You'll be hubbing this entire thing and putting the entire catheter in, and suturing once here and once here. But if it's an internal jugular line or a subclavian line, you'd be leaving about 5 centimeters out, and then you need to put this extra device. So there's a white edition and a blue edition. Put the white thing over here, and the blue thing over here. And this helps prevent the line from going in. And then basically suture here, and then over here. And then again over here and over here for 4 total sutures. And then once you're done with that, final step is to take our Tegaderm, place it on. Okay. And then you order an X-ray and make sure that it's in the appropriate place, assuming that you did an internal jugular or a subclavian.
Perfect. Thank you.